welcome. We have our favorite government person here today, somebody who's always helping out Milford and the people around as well as the rest of the state. Why don't we, if there is somebody who doesn't know who you are, let's start with an introduction.
Hi, great to be back. I'm State Senator Becca Rausch. I've been serving in the Senate since I was first elected in 2018, sworn in 2019, so it's been the better part of a decade now. And it is a real privilege to serve the wonderful town of Milford and all the people here.
We'll start with the basic. How's the budget looking?
The budget was on time this year, which was fantastic. That was the first time in my entire tenure in the Senate that we had an on-time budget, which was a wonderful thing. We keep working for it every year, and we got there, so that's terrific. It's a $61 billion budget, and so we have a lot of funds going to a lot of different things. The biggest chunks of that are going to education and healthcare, and all sorts of pieces of our economy and environmental protection and climate action. And it's a $61 billion budget. There's a lot packed in there. Milford is on the receiving end of roughly $60 million of those dollars for a variety of things, mostly for education. For the school system here, and also some local government aid and for roads and bridges and other sorts of transportation funding. And, there's bits in there for Chris's Corner and other sorts of support for the community. So all things considered, particularly given the political climate and the state of pretty serious uncertainty that we're in fiscally because of the both actions and inactions of the Trump administration that are just generating real problems financially kind of everywhere. Our budget is in pretty decent shape.
That's amazing because all you hear is everything's getting cut.
We did, there were things that didn't get funded as significantly as we would like. Things are absolutely getting funded from the federal government.
That's what I'm saying.
Yeah. But here in Massachusetts, we operate differently.
How so?
Well, we actually talk to each other, so that's an improvement. We trust science and understand evidence, and we don't dwell in rhetoric. We focus on action and meaningful results that are going to generate positive outcomes for people in their daily lives, right? You're going about your day, you're going about your life, trying to provide for yourself and your family, a roof over your head and food on the table, good education, a good job. That's what we're focused on, and I think that's what we're delivering.
Well, I see the controversy over vaccines.
Mm-hmm.
Can you explain that to me?
I really can't. You'd have to ask Kennedy and Trump, who seem to be out to kill us all by decimating our public health and infectious disease prevention infrastructure and systems by drastically, seriously, dangerously undermining public trust and confidence in vaccination, which has been one of, if not the greatest development and most important development in modern medicine history. Vaccines are safe. Vaccines are evidence-driven. Vaccines are tested. Vaccines are accessible.
Proven outcome?
Yes, and it is all. There's plenty of data to back up why vaccines are so important, why they are safe, and why they are necessary to keep each other and our society functioning. In fact, anybody over the age of 7 remembers what happens when we have rampant, serious, sometimes deadly disease running around without a vaccine. Because we all lived through, many of us, lived through COVID. Lots of people died. There was a confirmed case of measles in Connecticut just yesterday. We saw it in this morning's paper. It's, there was a whole school in Medford quarantined because of some norovirus. We know what happens when, and you don't have to look very far back in history to see what happens when we have dangerous, sometimes deadly, often deadly diseases running rampant through communities and societies without any vaccination protection. And when we have vaccination protection, We stop the disease in its tracks. And that's necessary, not just for those of us who can actually have a decent chance of fighting off the disease if we were to contract it, but ever so much more important for the people who are immunocompromised, the cancer patients, the babies who are too young to get a vaccine for measles, for example. Women who are pregnant, your immune system,
It's
is
compromised.
a little bit compromised because your body is playing host to another, growing, developing thing, and so we have a lot of really important reasons why
Well,
public health is so necessary.
we went through a scare of TB years ago.
Yeah,
And
scary.
I remember our immediate reaction was to ramp up the visiting nurses budget to make sure that the people who needed to take the medicine were taking it.
Yeah.
And the amount of disinformation, because I got people coming up to me saying, you're wasting money on all these immigrants. And I said, first of all, they're in Milford. They're Milford people now. So it's the right thing to do. But second of all, do you have kids? I have grandkids. I said, So if somebody with TB goes into the Milford school system in a classroom with your grandkids, you don't want to protect them? I was like, well, I never thought of it that way. I said, this is something that you do because it's the right thing to do. These are human beings.
Well, that's why I've spent so much time and effort writing and advancing the Community Immunity Act, which is one of my signature portfolio pieces of legislation. This is infectious disease prevention infrastructure that we are unfortunately missing here in Massachusetts. We have all sorts of different bits of rules and statutes in different places, and the Community Immunity Act will consolidate all of those into a single location so it's clear. Within our statutory law, it will make the process for exemption from immunization requirements clear and put the responsibility for those programs centralized and properly placed in the hands of public health professionals rather than what we have now, which is completely decentralized, totally disparately implemented. I wouldn't go so far as to call it chaos, but I will say there are some noted distinctions in implementation because every single school, sometimes on a school-by-school basis, sometimes on a school district basis, every single different child care program, every summer camp, all of these different, every after-school program, all of these different programs that serve kids are each individually responsible for implementing public health protocols, which doesn't make any sense. I think it's probably pretty easy for most people to agree that teachers already have a lot to do, and childcare providers already have enough to do. We don't also need to put this on them as well. It belongs with public health professionals. It's also, the whole system really has led to a lot of kids just falling through the cracks. And that's a problem. That's a real serious problem where we have schools throughout our Commonwealth that have more than 5% of their student body who are enrolled. They don't have any vaccination exemption on file, and they're also missing vaccines. That's not supposed to happen under current law, but it is happening. We have child care and kindergarten programs throughout the state that have lost herd immunity against polio, let alone measles or whooping cough or anything else. These are really, really serious infrastructure problems that we need to fix with an infrastructure bill, which is exactly why I wrote and filed and have now successfully advanced again the Community Immunity Act. It received a favorable report out of the Public Health Committee. It's now sitting in the Healthcare Finance Committee, and I continue to work with colleagues on advancing this bill. It doesn't require anybody to get a vaccine, but it centralizes everything. It standardizes the process, so the safety, right, the community health safety is consistent from community to community, which we don't have right now. It also provides better information, more accessible information to people about the safety and efficacy of vaccines. That's evidence-driven and sound medicine, and also provides information about funding, which a lot of people don't know. That we have a vaccine trust fund in Massachusetts. And so whether or not you have it, most people in Massachusetts have insurance or Mass Health or some kind of access to healthcare coverage, and preventive care is all covered. But if you don't have that for some reason, we have a backup system for you in Massachusetts, and vaccines are free, period.
Now, you talk about safety. I'm constantly reading papers,
Yeah.
being in the biotech field. I keep looking for the paper that ties vaccines to autism, and I haven't found any.
That's because it has been debunked time and time and time and time again. The author of that initial paper back in I think it was the 90s, don't quote me on that, but a long time ago, was resoundingly discredited, basically ran out of the science community. It's just not true.
But it keeps coming back. And we've got an anti-vaxxer heading up our Health and Human Services
Yeah,
Administration.
when you have a known anti-vaxxer who plays upon people's fear in order to line his own financial pockets, who has been denounced by multiple members of his own family, who also, unfortunately, has the support of the sitting president of the United States. This is what happens. You have raging, rampant misinformation and disinformation about a public health system and vaccination protocols that have been around for decades that are proven effective and safe time and time and time and time again. It's dangerous, and it is the fault of the federal government that we are here.
And it just seems like, okay, what happened to polio? We vaccinated, it went away. What happened to the measles? We vaccinated, it went away. Mumps, rubella. I mean, you go through all these things, and now you get these flare-ups because you got people coming from different parts of the world where they weren't vaccinated.
It's not just from other parts of the world. There are a lot of people here who are or under vaccinated. Some people don't even know, right? If you might be in either of our generations. And, vaccines are not permanent. If you get vaccinated when you're a child, eventually at some point you got to
need
get
a
a
booster.
booster. Exactly. So, people might not know, right? You might need a booster and you don't know that you need a booster. But that's part of why that community level herd immunity protection is so important. And we are missing it right now.
But that's the scary part when people start pushing misinformation. People can die from it.
People are dying from it. It's terrible.
Can we get around it? Can we get over it?
I hope so. But we won't get around it unless we make sure that we are doing everything we possibly can at the state level in order to combat that misinformation. And that's why my bill, the Community Immunity Act, is so important, because it's a huge part of what that bill will do.
What will the bill actually do?
Again, it will centralize and standardize the vaccination exemption process so that we take that off the backs of teachers and child care providers and those folks. We put it on the public health professionals, which is where it belongs. It will provide direct pathways to education and outreach efforts from the Department of Public Health into communities that have seen a drop in vaccination rates and thus are at elevated risk for the spread of infectious disease. In addition to providing information about that funding source, which I mentioned before.
But is it that we're just
really,
not
that's about
monitoring
it. Sorry.
We're just not monitoring it because...
Oh, no, we're monitoring it, but we, unfortunately, because of failures in our statutes and our state law, the Department of Public Health every year is really only empowered to put out a voluntary survey, which is a statement in and of itself, right? We don't have any sort of mandatory data reporting. We're actually missing data from a statewide perspective. We're missing data on nearly a third of the youth education programs from childcare all the way up through college in the state. We don't even have data about that.
But I thought you had to be vaccinated to go to public schools.
You're supposed to be. But again, because the processes and protocols and rules are disparately implemented in every single school district across the state, it's not implemented the same way from district to district and from school to school. So we don't have that kind of consistency.
So the rules are there.
some of the rules are there. Some of the rules need tightening. And some of the rules need clarification, which we provide in the Community Immunity Act.
'Cause you would have thought just coming out of COVID that people would understand how important it is.
You know, Al, I would have thought the same thing. And in fact, I did think the same thing when we were at the beginning stages of COVID, that wow, people will really see how important vaccines are now, because we're literally trying to live through a deadly global pandemic. And that's just not what we saw. And that's not what the outcome was.
But it's so dang easy. I mean, I went to CVS, can't remember why, just to pick up something. Oh, to pick up my monitor for diabetes.
Mm-hmm.
And I saw the sign, have you gotten your COVID and your flu shot? And I looked at the woman and I said, no, I haven't. How do I do that? 10 minutes later, I got a shot in each arm and I'm done.
Yeah, you go right over here.
Yeah, there's a
You
curtain.
just sit right there.
Step behind the curtain.
Right, exactly. It is, and it's not as necessarily as simple as it seems. For you, it's that simple. For other people, it isn't. Right? You happen to have 20 minutes.
Yeah.
Right. Some people don't have 20 minutes. Some people have work schedules that make it more difficult. We're particularly focused, especially in the Community Immunity Act, we're focused on youth, because that's when we get the bulk of our vaccines, is throughout childhood at various different stages. And there's a schedule that, again, is evidence-driven and medically sound, and we want everybody to be vaccinated on schedule so we all have protection. For some communities, there's very reasonable, historically based skepticism about the medical community. And so we have to be able to provide spaces for conversations that are culturally competent and linguistically diverse, to reestablish, or in some cases establish in the first case, that kind of trust, right? Trust is earned. And those are real concerns, and we did a ton of work on that during COVID, when the COVID vaccines came out. And in the communities where those conversations, those exchanges were successful, those communities were vastly better off in the long run in terms of outcomes, health outcomes for people, and far fewer deaths.
Well, I mean, like I said before, you do things because they're the right things to do, but you're protecting your own kids. I mean, you've got 2 young children.
Yeah, they're getting older by the minute. We aren't aging at all, right?
No.
Just the kids, they get older. Yes, I have a 6th grader and a 4th grader. My husband and I are very lucky. And we all, the fact of the matter is we all rely on each other for a lot of our safety. And this is part of that. Vaccines are part of that.
I've got a question unrelated to this, but how many committees are you on now?
I am on 8 committees, if you can believe it. I know it's tiring even just to mention it. I chair not 1 but 2 legislative committees, which is double the usual load.
Well, I kept looking and saying something's wrong. They didn't update this. Here's another one. Here's another one.
Yeah. So I am, again, this is my 3rd consecutive term chairing the Joint Committee on Environment and Natural Resources. So it's been now, we're heading into year 6 of me chairing that committee, which is just a wonderful committee, so much important work. Pretty much if it has anything to do with our climate or the environment and it's outside of the utility or energy space, it comes to my committee. Air, water, soil, forests, trees, oceans, wetlands. You choose whatever it is, pollinators, pollutants, rat poison. There's all sorts of different things that impact our environment, our natural resources, and our wildlife. And all of the bills pertaining to those issues come to the Environmental Committee. In addition, this session, the governor filed a $3 billion environmental bond bill, which is a significant piece of legislation that we recently advanced favorably out of the Environmental Committee. And so that has moved on to the Bonding Committee. And and we will soon be considering, hopefully soon. I don't know about the timing, but hopefully soon we'll be taking that up on the floors of both chambers, because that is a major, major piece of climate resilience and environmental protection legislation. And I very much look forward to continuing our work on that bill. So that's the Environmental Committee that I chair. I also chair the Joint Committee on Municipalities and Regional Government, of importance to literally every town and city, every local government official, every regional government official in the state. A massive number of bills come through both of those committees, actually. And in the Municipalities Committee, the governor also filed a bill called the Municipal Empowerment Act that has a whole bunch of different pieces in it. And so those pieces are under consideration now. And so we have two committees that I lead, and both of those committees got bills from the governor, in addition to all of the bills filed by myself and my colleagues in the legislature. And I also serve as the vice chair of the Senate Committee on the Census. That's the decennial census. It might seem like that's a long way off. Here we are in 2025, and 2030 is 5 years, well, almost just 4 years away.
It's going to be here.
We're going to blink and it's going to be here, exactly. And so a lot of that takes a lot of work to count 300 million people. So the prep work is actually happening right now. And we have had already 4 hearings, I think, 4 or 5. I'd have to go back and check, but several hearings on that committee, where we have been really digging in deep on the nuances of the census, on the census rollout, on how the prep for the census goes and should work, in order for us to make sure we're counting every single person, on what's going to what has happened historically with communities that have traditionally been hard to count, how we're going to try to overcome that in 2030, and it's going to be really, really, really hard.
ICE paranoia coming in.
Yeah, it's going to be extremely difficult.
People are hiding.
Yeah, people are hiding. Some people are leaving. Some people are coming in and not. I mean, it's. I don't think anybody's coming in right now, to be honest. But for the people who are here, they are.
It seems the other way around. I mean,
yeah,
for the first
people
time,
are leaving. People are leaving.
We're down 250 students this year from last year.
Yeah.
Which is amazing for Milford.
So we actually, on the Census Committee, the Senate Census Committee, that's a Senate standalone committee. Most of our committees in Massachusetts are joint, House and Senate together. We held a hearing specifically on outreach and participation. And we wanted to hear in particular from advocates who work with immigrant communities, communities of color, and other communities who are traditionally hard to count populations. We saw a problem with this in the 2020 census because Trump was pushing an immigration and a citizenship question, which failed. But we did see undercounts in immigrant communities across the country. And so we brought in these experts to talk with us on the committee and have an exchange about what we might be able to do to encourage participation in the 2030 census. Because for every person that we don't count, we lose roughly $2,500 of federal funding every single year for a decade, right? For every single person that we miss, let alone all the other things that we lose in terms of providing services for those people. So
we look at
we actually
Milford
had
saying we got 29,000 people, but we really have 32.
That would not surprise me.
And you turn around and say, if you don't count them, and you count on supporting 28,000 with local health services and all, and it's 32.
You're 4,000 people short, right? Now, we actually had an advocate say to us in the course of that hearing that she thought, or he, actually I don't remember who it was, but I remember the testimony. They said it was going to be nearly impossible to get participation from immigrant communities because the fear is just so very significant right now. And then instead, if we wanted to minimize the undercounts, that our best efforts would be to focus on all of the other hard to count communities, which is one of the saddest things I have heard in the last several months. But I understand it. I mean, it's like a secret police out there grabbing people off the street. It's terrible.
If you listen to what they're supposed to be doing, I have no problems with ICE arresting murderers, rapists, criminals. You come
They're
into
pulling
my,
people out of line in their naturalization ceremonies. I mean, it's awful.
but if
and
they have a
horrendous what they're
warrant
doing.
and it's a criminal, that's one thing. But when you hear them picking on, people, my family's here because people in Milford gave my grandfather in 1939 a chance. Now, he came legally, but they accepted him. He came here with $32.80 in his pocket and worked hard. And I'm always amazed because he had 3 daughters and a wife that he left behind in Portugal to come here and earn enough money and live subsistence wages, because every penny he could save,
Sent back.
he sent back for his family.
Yeah.
People like that, you have to, they come, they put their heads down, they work hard, they pay their taxes.
The truth is, we're a nation of immigrants.
Yeah.
All of our families, unless you are part of an indigenous population, which is a very small percentage of our the total number
Yeah,
of
we
our
didn't treat them
population.
very well either.
Not even a little bit. But so let's say the overwhelming majority of our families were all immigrants at some point.
And again, for the people who come here, put their head down, work hard, and pay taxes,
It is a very dark time in our country, unfortunately. And we know who's in charge of it.
but we get really worrisome. It gets very worrisome when you start saying people are scared to go to church.
People are scared to go to school. People are scared to go to the doctor. People are definitely scared to go to the police. In fact, we saw during COVID, when people couldn't go to the police and people were stuck at home, we saw huge rises in domestic violence and other home-based concerns. And we're, for totally different reason, but we're seeing similar problems. It's terrible.
But what can you do? I mean, the federal law is the federal law.
Well, that's true. The federal law is the federal law, and ICE is subject to the control of the President of the United States and not the state government. And so there are certain things that we can do, and we are working on advancing those legislative efforts in Massachusetts. But you're right that there's just not that much, if anything, that we can do about ICE's activity.
Well, I mean, we've had that discussion on the show many times, saying locally, you have no control of immigration policy.
And that's true. We don't. That is a function of our federal
You can't deport
government.
them to Rhode Island.
We can only do the best we can within the spheres that are actually under our control, like public health protections, like education, like universal school meals. We've done that. We funded them. We were talking about the budget a little bit ago. We've fully funded universal school meals, breakfast and lunch, every kid, no questions asked. That has been a huge equalizer. We've funded civics education, which is something that I've been leading on now for several years.
The meals thing was something that just, I can't imagine anybody in Milford saying they don't want kids to have proper food.
I think it's now a very widely popular program. It wasn't when we first did it. And it was, in fact, a federal initiative that at the beginning of COVID. They did it in COVID.
Funding.
The federal government put money into universal school meals during COVID because so many people were out of work. And then subsequently, the federal government just stopped. And we in Massachusetts said, no way, we're going to keep going. And so we figured out a way within our means in the state budget to keep going with that program, which is great. Now, if the federal government comes back and cuts, millions and billions of our dollars, we're going to have a much tougher budget outlook.
But that's got to be an easier sell for people if you have to increase taxes, if you're doing it to feed kids.
I don't know, Al. Nobody ever wants to pay more taxes.
Well, nobody wants to pay taxes. I mean, I'm always saying we pay too much in Milford. The average price for a house in Milford is $5,900 a year in taxes. But if I look around, the $5,900 doesn't seem too bad.
It's, I would say it's probably, I don't know, actually. I don't know what the numbers are. But it's a tough thing. Nobody wants to pay more taxes, but everybody wants better and more enhanced services. So, and more a wider breadth of services.
So getting back,
That's a challenge.
how did you get on 8 committees? How does that process work?
Uh,
Did you miss 6 meetings?
No. I was appointed by the Senate president to serve in these capacities, and so we talked about the 2 committees that I chair and the committee that I serve as the vice chair for, and then I serve on 5 other committees, including revenue and children, families, and persons with disabilities, and 3 more beyond there, and tourism, arts, and culture. It's a hefty load. I am grateful to the Senate president for her vote of confidence in me, and my skill and my ability to serve in all of these capacities. And the truth is, we have a lot of committees. We have a lot of areas of law. We have 7,000 bills that get filed every session, and
Yeah,
we only have 40 senators, so we all have to serve on committees.
Karen gets up one morning and says, "I'm ticked off at Becca. I'll put
No,
her
no,
on
no,
2.
no.
I'll put her on 2 more committees."
I really do believe that it's a vote of confidence.
Oh, it is. I'm joking, but 8 committees.
It's a hefty load. It's impossible to get to every single hearing.
And then you got the overall committee called Mother.
Yes, that is the most important committee, the parent committee. And as I mentioned, my husband and I are very lucky. We have 2 great kids and a wonderful dog whose name is Melody because she likes music. And she's kind of a big, floppy lump of love, and she's super cute. She's going to be 3 in a couple months. And
But you get a say in this. I mean, when you're up to 6 committees, and most people don't have anywhere near that load. If they say, "Can you serve another one?" Don't you get to say, "Help"?
We want to make sure that the Senate is well represented on all of the joint committees, in addition to all of our Senate standalone committees, and it's a real honor to serve. And it's also very interesting. Right? I learn something new every time I go to a different hearing. Most of the hearings are done at this point. We bumped up the legislative calendar and the schedule, so the deadline for most of the hearings already passed, which unless there were some late file bills, which happen every year, and so those hearings continue. And the Senate Census Committee, which doesn't receive bills but does a lot of investigatory and nuanced work, that is ongoing. But the joint committees that receive those bills that everybody files, most of those hearings, for all of the timely filed bills, those hearings are done. They finished a month ago. Don't quote me on the timeline. Everybody has their
But
own separate
overall,
schedule.
things like Chapter 70, Chapter 90, those are the ones that hit hard. How does the funding look for those?
I'm hearing from the budget leadership that we should kind of brace ourselves for fiscal 27. We talked about the 26 budget already. I think fiscal 27, because of the uncertainty from the federal government and the kind of fiscal chaos that Trump has wreaked all over the place, I think we're going to be in for a bumpy ride in fiscal 27, so we'll have to see.
Well, we've been lucky. We got a $7 million bump. I mean, when the new legislation went in from the state and they targeted towns that had high special needs, high immigrant, and high low-income earners, Milford rang the bell all 3 times.
Yeah, so that bill was called the Student Opportunity Act. It was signed into law. It was one of my very first votes, actually, when I was first elected. It was signed into law in 2019. We are on time, on schedule, on budget, funding that piece of legislation. So that's been on track, which is good. It does support English communities with a higher numbers of English language learners and special needs students and excuse me, a variety of other pieces. I will say that the special education funding portion of that, I think, needs some serious attention. A lot of communities are just really in trouble.
Well, we've been fortunate. I mean, there's been 16 years straight of surpluses for Milford.
Yeah. Al, I'm so sorry. I need to get a tissue. I will be
Okay.
right back.
Well, we're hearing from Becca Rausch, our state senator, a long-time Milford proponent. And the good news is it seems like the state is weathering the federal cuts, but it's a scary movie when you start looking at major cuts in funding, because once there's a fixed amount of money, and the programs that you cut home. You know, anything to do with the schools, even things like Chapter 90, which is the highway bill. When you look at the costs going up for every road, you start cutting back on the funding, and you have a lot less money to do work with. We've been fortunate that our representatives have been very successful safeguarding Milford and helping us get through this.
Thanks for your patience. Sorry about that.
No problem.
'Tis the season of tissues, among other things.
Well, you have children in the incubator.
Yeah.
Whenever we used to send our daughters to school, we called it the incubator because they came home with all sorts of presents.
I also teach dancing to kids, so I see a lot of kids, and it's also just, I think I don't know, I might be reacting to something. Anyway, where were we?
Well, the question on Chapter 70.
Yep, so that's part of the budget, and we will have to see how those numbers sort of play out. But I do think the special education funding, in particular, is something we're going to have to take a look at from a policy perspective, because we're seeing multiple communities face really significant budget challenges because of special education funding and the way that money works. So it's a real challenge, and I've filed legislation on it to get a group of people who are really smart people all in the room together who know about education funding and special education funding specifically, and try to rework that portion.
Well, it's one of these things that you say, thank God I don't need to use special ed. But
Our special education professionals and systems in Massachusetts are really among the best. And I think that's part of why we have such significant funding needs in that space, is because we provide really great services. So we just have to get the balance right. I don't think we're quite there yet.
Well, when you start looking at the costs, the thing we did years ago is we funded the special needs first as a separate item, then picked up the school, because we've been going up 7-8% a year overall, like a lot of towns are.
Yep.
But what choice do you have? These are our kids.
These are our kids. That's right.
You have to take care of them.
Yeah.
And we've been fortunate.
You said it, sir.
We've been fortunate that we have not had to use profanity in the finance committee meetings.
I'm very glad to hear that.
It's a standard joke when somebody came in and started talking about the middle school that we were building for $60 million. And he started using profanity, and I called him on it. And the poor man looked at me and says, "What did I say? I didn't use profanity." I said, "You said 2.5 override or debt exclusion. Those are the most profane words I know."
It's, it's a challenge. There's a lot of debate happening right now on Beacon Hill about Prop 2.5, and not necessarily on Beacon Hill, but in our communities, we're seeing, Boston Mayor Michelle Wu talk about it a lot. The truth of the matter is we have to find a good balance between kind of shielding people from a really significant tax hike in any given year. People can't afford it, right? You can't afford a significant.
A lot of people are right at the break point
right,
now.
Exactly. So we have to have those kinds of limits in place, and we also have to recognize that inflation is bigger than 2.5% right now. And costs are rising at a rate that is more significant and higher than 2.5%. And also, I think there's probably some balance to be struck between empowering municipalities to make good choices based on those municipalities, and supporting our local government officials here in Milford and all across the Commonwealth who know what's going on in the community and are, in fact, are elected by their communities to make those kinds of choices for that community. And then the question becomes, do we really want to force them to kind of go through the Beacon Hill legislative process, right? I have a video on my website that's it's called How to Pass a Law in Massachusetts in 20 Easy Steps, which is ridiculous. But for a lot of these bits and pieces, even something as simple as changing the name of your governing body from a board of selectmen to a select board, right? That's a change that often has to actually have a bill filed that, in this case, Representative Murray would file. And in fact, we're working on some of these now, he and I. And then it has to go all the way through the House and all the way through the Senate and get signed by the governor in order to implement something that the voters in Massachusetts, in Milford, and the local town elected officials in Milford probably should just be able to implement on their own without having to go through this whole process on Beacon Hill. So I've actually filed a bill on that as well, which has advanced favorably and is sitting in Ways and Means now. So it's everything in governing really is about finding a balance.
We're right in the process of the feasibility study for the new high school.
Yep, you are.
And that's going to be in the, $300 million range. We haven't given up on not using profanity.
Good.
We're trying like heck to come up with creative ways.
It is definitely a time to get creative.
Now, I hear things like you're working on data privacy.
The Senate actually has already passed legislation on that. And we've kicked that over to the House. So that bill is over now in the House for their consideration.
What is that about?
Well, let's say you used a credit card to buy that cup of coffee. We want to make sure that that credit card doesn't get picked up by somebody else and used elsewhere for someone else's spending spree. We want to make sure your personal information is protected so that your identity doesn't get stolen. And the fact of the matter is, with the advent of the digital age, where we are now, especially with AI coming online already online in so many different ways, people need more protection than ever. You don't even know where your data is half the time. Most of the time.
Or the impact. Because all of a sudden you get the phone call that your credit card's been compromised, and then you realize you have to make 8 or 9 different calls to all these companies that have direct pull.
Right. So those are very real challenges for people. And there's work that we can do at the state level to minimize those impacts. And so the Senate has already advanced legislation that we've passed. I voted yes. And that already happened earlier in 2025. And now it's sitting with the House for their consideration.
You're always big on reproductive rights.
Indeed. One of my cornerstone issues.
It's been quiet lately. Should I be worried?
No, you should not be worried. My Abortion Access Act had a hearing last month before the Judiciary Committee. We've made significant strides in Massachusetts. We are not yet where I believe the residents of Massachusetts think we are. People like to think Massachusetts is one of the top of the nation in terms of access to reproductive health care. It's just not true.
We're not?
Nope, we are not. According to the Guttmacher Institute, we are outside of the top 10. So we have
kidding.
No, I wish I was kidding, but I am not. So we have some work to do. So that's why I've really delved in. We actually passed into law a portion of the Abortion Access Act last year, signed by Governor Healy, to combat anti-choice so-called crisis pregnancy centers that are really quite dangerous. And so we've advanced portions of this bill already. Remaining portions of the bill.
Anti-choice pregnancy center.
Yeah, in fact, PBS NewsHour just did a whole big spotlight on them. These are organizations that hold themselves out as healthcare providers and overwhelmingly are not actually healthcare providers. They use the same pink as Planned Parenthood to lure people in. They and other similar deceptive tactics to lure people in, often people who are seeking abortion care, and then kind of blast those people with anti-abortion propaganda. And that's, it's in many cases dangerous. It's just dangerous to the health of the pregnant woman.
Well, you would think she's in a crisis in her mind anyway.
We don't even know, right? Sometimes yes, sometimes no. It doesn't really matter. The point is,
But why
for
add
people
to
who
it?
seek abortion care, for people who are seeking abortion care, they should be able to rely on accurate information given by accurate clinics that are medical clinics and healthcare professionals, not anti-abortion propagandists. And so, but it's very difficult to regulate these anti-choice centers for a variety of reasons, including but not limited to the Constitution, which even though the President of the United States might not care about the Constitution, I care about the Constitution. And we need to work within the confines of it and the rules and structure of the Constitution. And so last year, we passed into law legislation that requires ultrasound technicians to work under the supervision excuse me, of licensed professionals who can actually read the ultrasound.
That wasn't a law?
Nope. And this is part of why these anti-choice centers have been flourishing. Because they provide ultrasound care, but they're not medical professionals.
But how do you have a clinic that isn't licensed? I mean, I'm opening up a CLIA lab. And for the past month, I've been going through all the steps.
They don't call it a clinic, they call it a center or some other kind of word that is
Yeah, but
kind of implies that they might provide
my
health care,
company
but they're
is
not actually
creating a
providing
new
health care.
we can do what we want, but if we're going to use it for anything but research, if it's going to dictate patient outcomes, all of a sudden we fall into the CLIA Act of Food and Drug Administration has rules. Don't these other people have to have rules?
Well, we're trying to make those rules. And in fact, I did just make one, right? We enacted one
Yeah.
into law. And it was the nation-leading kind of legislation. But it's a lot. In fact, there was a big court case that came from an anti-abortion center where a pregnant woman went in. They did an ultrasound. They told her they'd read it properly. They told her she had a viable pregnancy. And off she went on her way. And it turned out it was not a viable pregnancy. It was an ectopic pregnancy. She was rushed to the emergency room, and she lost huge amounts of blood. Her life was in danger because of the misread. And so we want to make sure that ultrasounds, when they are performed under the supervision of someone with an actual healthcare license. So there should be no anti-abortion centers in Massachusetts performing ultrasound care anymore. And that's often what pregnant women do a Google search for. Right? How can I get an ultrasound to confirm my pregnancy?
I was going to say, I don't want to seem cold, but forget that it's an anti-abortion or it's an abortion anti-clinic. It's a medical procedure.
An ultrasound is a picture, right? A scan.
But it's dictating a medical diagnosis.
The reading of it is yes.
I mean, taking the ultrasound, okay, I understand, but interpreting it, like you said, you could put
It's
somebody's
medical.
life in danger.
Exactly. So now we have law in Massachusetts that I wrote.
Congratulations.
Thank you very much. It was a huge win, a really big accomplishment, and that was actually part and parcel of a big package on maternal health. So we now provide licensure for home birth midwives and midwives who perform and provide care outside of a hospital setting. We've bolstered doula care in that bill. We've got all sorts of really good things that came into that package that was signed into law in August, I believe, of 2024.
And again, I come back to, if you're providing medical services, you should have some degree of competency.
You should have a license.
Yeah.
Not just competency, but you should have a license to practice.
It's amazing when I learn that things that I would take for granted to say it's a given, it's common sense, that if you're doing medical care, you're licensed. Oops.
Yeah. Well, that's why I have a job.
On your website, you talk about
Excuse me.
better government transparency.
Hmm.
What does that mean?
We want to make sure that you have I want to make sure that you have all the information that we have. Whatever it is that we're working on, we are elected by people. Excuse me. And I want to make sure that public records are public, that and accessible, that all of our votes are public, which they now are, which is terrific. That was not true when I first came in. And transparency and accountability. We consistently work to make sure that reports are made public and other documents that we're receiving with evidence about healthcare, education, climate, transportation, whatever your issue is, that those reports are also made public by posting on a website or whatever have you. And so we keep working on that. And
Can
also
I get all that through FOIA?
In Massachusetts, that's called a public records request. And in theory, yes. But you shouldn't even, at least from my perspective, you shouldn't have to file one for some of these really common things, right? A lot of people might be looking for XYZ report. So just post it on the website. It's not that hard.
Well, we went through that when people cornered me and said, how do we learn what the Finance Committee learns? And it hit me like, well, I'm spending your money. You should have it. So for the capital, all the capital requests of the town go through the capital committee.
Yep.
And I made it a point to say, every time I get anything, I give it to our helper,
Mm-hmm.
and he puts it up on the website.
Yeah. See, it's not so hard.
No. I mean, I think it's all a mentality thing because it's not my money. You know, you mentioned my coffee. If I want to spend $3 on a cup of coffee, I can. It's my money.
That's right.
But before I spend $3 of your money on a cup of coffee, I want everybody to understand why I thought it was a good idea.
Yeah. So, one of the ways that we've enhanced transparency in the government is all of our hearings are hybrid, right? And they're all recorded. All of our Senate sessions and House sessions are live streamed, so you can follow right along. You might put yourself to sleep sometimes, but you can follow along if you want to. Some of them are very exciting, and some of them are just, sort of more run-of-the-mill.
Have we made
Making
progress
the cogs of government go.
Have we made progress in making more and more of the committee meetings public?
I think we have.
Not on your level, but on the town levels, do you know?
It varies a little bit by town to town. That is one of the issues that has come before me as the chair of the municipalities committee. I also have a standalone bill that I personally have filed on hybrid public meetings. What I'm gathering from the data that we've received so far is that most of the communities in our Commonwealth are already actually providing hybrid access, or at least live stream, follow along access to a lot of the public meetings. It's not universal. In some places, it's not actually feasible because they don't have the space, or they don't have the technology, or they don't have broadband, right? Certain communities, it's known as last mile broadband. Certain rural communities are still lacking sufficient internet access. So in some places, it's just not possible. And even in a community with resources like Milford or Needham, where I live, you have a lot of boards. There are a lot of boards and bodies.
We figured out all
right?
the subcommittees inside, like the finance committee's got 12 subcommittees.
Exactly. And then you have the select board and the school committee and all the zoning
those big
board.
committees you can cover. It's all the subcommittee ones that, when you start figuring out how many nights you'd have to tape.
Exactly. So it's just not feasible, at least at this point, because even in a community like Milford, maybe you have 1 or 2 or even 3 rooms that are equipped to provide hybrid access, but you have 27 meetings happening all at the same time, and obviously that doesn't match. So we have to, again, as with all things in governing, find that balance.
Even conducting the meeting, the hybrid meeting, properly, with the roll call vote.
Yeah, it's a challenge.
Versus, okay, who's in favor? Hands go up, down. Okay, 5 seconds later, you move on.
Right.
Now you got 15 people that have to individually vote.
I mean, there are ways to manage that. A lot of communities have digital voting, so they don't raise their hands anymore at all. They just click a button.
Well, we've gotten pretty good. I mean, the chairman will look and everybody will go, yep, 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 yep.
Yep.
You know.
Yeah. Sometimes you do, and sometimes you don't. But I do think we've made noted advancements in that space. I think there's still some work to do, and we definitely need to make the rules permanent, right? I actually wrote the temporary rules back in COVID to allow for the hybrid meetings that we're having now. So I wrote those laws in partnership with some of my colleagues on Beacon Hill, and we passed them in the middle of COVID as emergency measures, and we keep renewing them and renewing them and renewing them. We
when
have
they
to get
first
to a
came out,
permanent
Becca,
solution.
everybody was growling.
Yeah.
You're getting used to, doing it with roll calls, getting used to setting it up was annoying, but
I mean,
it
we
didn't
had
take-
to. We didn't have a choice in
it
COVID.
didn't take long when you said, what choice do we have? We don't.
Yeah, we didn't because we couldn't
Oh,
come together.
Okay, so we can argue all day long, but let's just do it.
Right.
And then once we got used to doing it, it got more and more efficient. It's
Yeah.
like,
You figure it out. And mostly people have figured it out. It's not feasible for every single body
well, I mean,
because we just don't have the resources for that right now.
it's
but-
like everything. We have the discussion of saying there's a lot of people in Milford who are doing well financially. But we have to remember that for every dollar we spend, the people who built Milford could be living on $2,500 a month, Social Security. So there's that balance, and you've got it 320 times bigger with, all taken into consideration, little towns like Hopedale next door and big cities like Boston.
Yeah. Honestly, no two municipalities in the state are the same. Even the ones that are tightly affiliated through regional schools or, neighboring borders and things like that. Every town, every city is different in their own unique way. And yet we have a lot of similarities across municipal borders.
Well, we thank you for all that you do on 8 committees.
It's never boring, Al.
I'm going to say 8 committees, and the biggest one you don't get credit for, which is being the mother of 2 almost teenagers.
I do. I have a tweenager. It's an adventure, but we are very lucky. We love our kids, and it's so great to be here with you.
Well,
Thank you for having me.
Right now, I thought I was past it. Being 69 years old, I thought I was past it. Then now you got grandkids, and you realize, oh my God, we're starting again.
I hear it's a smoother ride, and that
Oh, it's-
grandparenthood is
Oh,
pretty
it's wonderful.
sweet.
We keep having discussions because my daughter objects to me building the carbohydrate titer up on my grandchildren. They love French fries and Dairy Queen ice cream.
Yeah, it's a popular choice.
And it's always one of these things where just before I drop them off, we can stop at Dairy Queen.
Oh, that's so delightful.
So the
I'm sure that
carbohydrate titer builds up.
Uh-huh.
We were at a meeting once when my phone lit up and it said, "You are a dead man." It was Easter, and my grandson looked and said, "Vovo, I need that chocolate bunny." Oh, you need the bunny, you need the bunny. I thought it was a hollow bunny.
Oh, it was solid?
It was solid
Oh,
chocolate.
yeah, you're in trouble.
It was 9:30. We're at the finance committee, and the phone lights up because
9:30 p.m.?
Yes.
Oh, my gosh. Yeah, no wonder you got that text message.
Oh, yeah. Well, but and all kidding aside, thank you for everything you do.
Oh,
We look
thank you
forward
very
to
much.
working with you for many years to come.
It is a privilege to serve. Thank you so much for having me.
And as always, may God bless. May tomorrow be a better night than tonight. Thank you to our 6 loyal viewers for joining in. And if you have questions, Becca is very, very accessible. Get to know her and get to know all the good stuff she does for Milford. Good night, all.